So my name's Rebecca Godfrey. I'm one of the cardiology registrars in Brighton. And I actually initially trained to be a doctor at Brighton and Sussex Medical School. And then a great deal of my training over the last 10 years or so has been around the Sussex area. And now I'm coming towards the end of my training to become a heart consultant and focusing in on the area of heart failure and cardiac devices, which is pacemakers and defibrillators. I have applied for the doctoral fellowship because, in large part, of the project, and the research that I'm going to undertake is looking at patients who are undergoing a cardiac device procedure, so that's a pacemaker or defibrillator. And in many of those people, we don't know what's the cause of their heart disease. We're just treating the problem, and we're not altering the disease progress and the rest of their journey because we don't understand what's caused that problem. And this project looks at the potential for analysing a small piece of heart muscle tissue, which is obtained basically through the procedure we're doing anyway, and seeing if that helps us understand what the cause of their heart disease is, and does that alter their treatment plan. And I think the other thing about going into research as a clinician is that it's that unique opportunity to have protected time to really invest in a project and to build collaborations, learn from colleagues and others with different experience and interest in the field. So I think this has the potential to be really powerful for our local Sussex population. Every year, it's over 400 people getting a pacemaker or a defibrillator. And in many of those cases, we don't know the root cause of their heart disease. And I think it's fantastic for something like this, which could be game-changing, not just locally, but everywhere, to come from Sussex. And for our population to have that early opportunity to benefit from what we're learning in the field. I personally feel that Brighton is the perfect place to be doing this sort of research. So I've worked in the department on and off for many years now, and it's a big enough place that very sort of internationally leading research is being done. But it's also a small enough place that we talk to each other, we collaborate with each other. It's not the case that you've got different types of heart specialists working in their own little field and not discussing developments and innovations. So already over lunch in the Cath Lab seminar room, others have been sharing insights and offering thoughts as to how we might progress this technology and its potential for our patients. This work has a lot of potential in the longer term, not just for the course of the MD project. And I think it's fantastic that the Charity Doctoral Fellowship recognises that for many people, their research involvement continues beyond the scope of their MD or PhD. And I would love for this to become part of my career in the longer term, developing this technology, better understanding how we can improve care for patients in the field of heart failure and cardiac devices. And I would love ultimately to have a job which is a balance of clinical practice and academic work. And I think that's the way that we perform best for our patients, is being at the forefront of what we can possibly do for them, but also involved in their clinical care. So I think it's important to ask the question of balancing work and life. And it's been great to see that the Charity Doctoral Fellowship actually offers some, if you're organised, some protected time in the lead up to doing research. And that perhaps for me is one learning curve that I would recommend others look into ahead of taking time out to do research. But I think it's an important thing to discuss. There aren't so many women working in cardiology or particularly in academic careers. And I think it's important for women coming through as doctors and as medical students and in schools to see that there are people who have a family life, who are working less than full time, who are working as clinicians and managing some academic involvement and actually thriving doing all of those things.